Good afternoon, Mrs. Smith. You've been referred to the eye clinic this afternoon because the pictures that you've had taken of your eyes recently at the diabetic eye screening visit showed some disease. Have you had any problems with your vision?
Not that I'm aware of, no.
No. How long have you been diabetic?
Since my mid-30s.
Okay, so you've had it probably about 20 years? Okay,
Yeah.
and you're on insulin, I understand.
Yeah, that's right, yeah.
Do you have any other health issues apart from being diabetic?
No, none at all.
Okay. And have you been to the screening program before?
For photographs, yes.
Yes. So you've had it before?
Yeah.
Okay. So this is the first time disease has been identified?
Yes, it is, yes.
So this is a picture that has been taken of your right eye.
Okay.
And I don't know whether you can see, but you do have quite a lot of bleeding. This is a picture of your retina, which is where the disease occurs. And this is the most important part of the eye. And you can possibly just see these little yellow spots.
Yes, I can, yeah.
These are all indicating that you have fluid that is leaking in that part of the eye. Now this needs treatment, otherwise it will affect your vision. So if I may, I'm just going to firstly have a look at you on the machine, and then we'll talk a little bit more about what treatment is required.
Yeah. Okay, yeah, that's fine. Specs off, obviously.
Yes, this will not hurt. All I'm going to do is have a look at you with this machine.
Okay.
It will shine a bright light into your eyes, but that's all there is to it. All right?
Yeah, fine.
You can put your chin on here, and if I can get you to just look straight ahead to begin with. Just a bright light coming on. Just keep looking straight ahead for me. And look up for me. And over to your left. And your right. And look up. And down. I'm just going to have a look at the other side now. Again, look straight ahead for me. Look to your left. And to your right. And look up. And look down. Okay, that's fine. Sit back now.
Thank you.
Okay, Mrs. Smith. The findings that I've made on that pretty much tally with what is on the picture, and therefore you do need treatment. The treatment will not necessarily improve your vision because your vision is still good, but it will help to preserve your vision. And without treatment, it is likely that you will go on to lose vision. So the treatment I'm going to be recommending initially is a form of laser treatment.
Okay.
Laser treatment, we'll be making an appointment for you to come back for that treatment. It won't happen today, and that appointment will be in probably a few weeks' time. And you attend like you have done today.
Yeah.
Laser is a bright beam of light. You sit in front of a machine very similar to what you've just gone through. It takes a little bit longer, perhaps 10 minutes, for the laser treatment to be applied. Generally not painful, and it's a day procedure. So you come along like you've done today, have it done, and then you're free to go home. There's no particular aftercare afterwards.
Okay.
And the likelihood is that thereafter you may need a few more sessions of laser.
Right,
All
okay,
right.
yeah.
Do you have any questions?
No, not at all. Is there any anaesthetic involved?
No, we treat pretty much with the use of eye drops.
Okay.
Yeah. So, as I say, you sit in an identical position to what you were just now, and the laser sounds frightening, but it isn't. It is just a bright beam of light, just a little bit brighter than what you've experienced just now.
Yeah.
And it doesn't take very long, usually between 5 to 10 minutes.
Okay.
All right?
Yeah, no, that's fine, thank you.
What I will now do is make an appointment for you to come back for the laser treatment to be done.
Okay, that's
All
lovely.
right.
Yes, thank you very much.
Can I ask you to introduce yourself?
Yes, my name is H.C. Chen. I'm the clinical lead for the diabetic eye screening program in Derbyshire.
Why is diabetic eye screening important?
Diabetic eye screening is important, as with any screening process, because we're looking for disease that the patient is not aware that they have. So, for example, one can have quite severe diabetic eye disease and not be aware that there is a problem. So a person can have quite significant diabetic eye disease without suffering any vision problems. Only with screening can we identify the problem and hopefully then apply the necessary treatment before the disease has an opportunity to cause problems.
What happens after screening?
When you come along for the diabetic eye screening, we take a series of photographs of the back of both of your eyes. Diabetes damages structure inside of the eye known as the retina, which is the equivalent of the film in the back of a camera. These pictures, once we have captured them, are looked at another day, usually a few days later, by trained diabetic eye screening graders. And the pictures, if found to be problematic, that means if disease is found, then those pictures are looked at by myself, being the clinical lead for the program. If I felt that the disease warranted treatment, then an appointment will be made for the patient to attend the hospital eye service. So an appointment will be sent out to the patient from the eye clinic here at the Royal Derby Hospital. The patient then comes along and is assessed by an eye doctor. If the eye doctor who sees the patient on that day agrees with the pictorial findings, then treatment may well be necessary. And treatment can be in the form of either laser or something that is more involved. And obviously the treatment options are talked in some length with the patient when they attend.
Thank you for giving us your time, Mr. Chen.
Well, thank you for asking me these very important questions. And I do urge all diabetic patients who will be in receipt of an invitation to come along for their eye screening to keep or to make an appointment, because it is vital that your eyes are examined on an annual basis.